So I did want to begin finishing up my video on quercetin. I already did a previous video on this. So some of the benefits of quercetin in rejuvenation, the rejuvenating properties of quercetin. So let's talk about the bioactive effects of quercetin in the central nervous system, focusing on the mechanisms of action. Now, before I begin, I want people to understand I'm not a physician of any kind. I'm not an MD, not a DO, not an ND. I'm not a nutritionist. I'm not a dietitian. I'm not a chiropractor. I'm not a nurse of any kind. Please don't take what I'm saying as medical advice. If you have a medical question or a medical condition, seek the advice of somebody that is qualified to give you answers. I'm not. So quercetin is a ubiquitous flavonoid that is widely distributed in plants. Is classified as a cognitive enhancer in traditional and oriental medicine. The protective effects of quercetin for the treatment of neurodegenerative disorders and cerebral vascular diseases have been demonstrated in both in vitro and in vivo studies. The free radical scavenging activity of quercetin has been well documented, wherein quercetin has been observed to exhibit protective effects against oxidative stress, mediated neuronal damage by modulating the expression of NRF2-dependent antioxidant responsive elements, and attenuation and neuroinflammation by suppressing NFK or NFKB, signal transducer, and activation of transcription 1. STAT1. Okay, several in vitro and in vivo studies have also shown that quercetin destabilizes and enhances the clearance of abnormal proteins such as beta amyloid peptide and hyperphosphorylated tau. These are two of the peptides that are present in people with Alzheimer's, or was believed to be present in people with Alzheimer's. So these are key pathological hallmarks of Alzheimer's disease. Quercetin enhances neurogenesis and neuronal longevity by modulating a broad number of kinase signaling cascades, such as phosphoinsatide 3 kinase, okay, blah, blah, blah. So quercetin has also been well reported for its ability to reverse cognitive impairment and memory enhancement during aging. So keep that in mind. Quercetin has been well reported for its ability to reverse cognitive impairment and memory enhancement during aging. Quercetin supplementation is effective in improving mitochondrial dysfunctions induced by 3-nitropionic acid implications in Huntington's disease. The study was designed to investigate the beneficial effect of quercetin supplementation in this induced model of Huntington's disease. Okay. So essentially, let's look here. So the Huntington's disease was induced in rats by administering subchronic dose of 3-NP, twice daily, blah, blah, blah. Quercetin was supplemented at a dose of 25 milligrams per kilogram of body weight by oral gavage for 21 days. At the end of treatment, mitochondrial bioenergenics, mitochondrial swelling, oxidative stress, neurobehavioral deficits, and histopathological changes were analyzed. Quercetin supplementation was able to reverse this type of induced inhibition of respiratory chain complexes, restore ATP levels, attenuate mitochondrial oxidative stress in terms of lipid peroxidation, and prevent mitochondrial swelling. Quercetin administration also restored the activities of superoxide dismutase and catalase along with thiol content in this type of treated animal. Beneficial effect of quercetin administration was observed on the motor deficits analyzed by narrow beam walk and footprint analysis. So their gait was back to normal. Okay, altogether, our results show that quercetin supplementation on this type of Huntington's disease induced in this animal ameliorated mitochondrial dysfunctions, oxidative stress, and neurobehavioral deficits. As I've noted before, quercetin is a powerful antiviral. Okay, so quercetin and its derivatives as antiviral potentials, a comprehensive review. Quercetin, widely distributed in fruits and vegetables, is a flavonoid known for its antioxidant, antiviral, antimicrobial, and anti-inflammatory properties. Several studies highlight the potential use of quercetin as an antiviral due to its ability to inhibit the initial stages of virus infection, to be able to interact with proteases important for viral replication, and to reduce inflammation caused by infection. Quercetin could also be useful in combination with other drugs to potentially enhance the effects of, or synergistically interact with them in order to reduce their side effects and related toxicity. Since there is no comprehensive compilation about the antiviral activities of quercetin and derivatives, the aim of this review is providing a summary of their antiviral activities on a set of human viral infections. Quercetin is the major representative of the flavonoid subclass of flavonols. It is found in many fruits and vegetables, and among vegetables, the highest levels of quercetin have been found in onions, asparagus, red leaf lettuce, and lower levels have been found in broccoli, green peppers, peas, and tomatoes. Apples are the fruits with the highest quercetin. Remember, it's in the skin of the apple, though. Together with cherries and various berries. And so various berries also contain quercetin. Quercetin in foods is not present as a glycone, which means without sugar, but quercetin glycosides, once ingested, quercetin glycosides are hydrolyzed and released without the sugar molecule. Okay, so the dietary intake of all flavonoids has been estimated to over 200 milligrams a day, while intake of flavonols is about 20 milligrams per day, of which quercetin is more than 50%. While a daily intake of approximately 10 milligrams a day, a study carried out in Japan supported these estimates, as daily intake of quercetin was determined to be 16 milligrams a day. Quercetin supplement, but remember, that's in Japan where they actually eat fruits and vegetables. Quercetin supplementation may promote antioxidant, anti-inflammatory, immunoprotective effects, okay, added to the ability to inhibit lipid peroxidation, to inhibit platelet aggregation, capillary permeability, and to stimulate mitochondrial biogenesis. Due to its high solubility and bioavailability, quercetin is being used increasingly in new preparations for human health. Furthermore, quercetin has been studied in various types of models of viral infection due to its promising antiviral effects and inhibiting polymerases, reverse transcriptase, proteases, suppressing DNA gyrase, and binding viral capsid proteins. Okay. A strategy could be to enhance people's antiviral immune response through a nutritious diet, including pure quercetin isolated from natural extracts, in order to minimize the risk of infections. Recently, quercetin has been used as an adjunct in the unspeakable thing that shan't be spoken of. Okay, antiviral activities of quercetin. Okay, the Flaviviridae is a family of enveloped positive strand RNA viruses. The family include the genera of Flavirus, Pestivirus, Hepavirus. Okay, so these are different viruses. So treatment with direct-acting antiviral drugs has dramatically changed outcomes for hepatitis C. Indeed, the sustained viral response rates have reached unprecedented levels without relevant adverse effects. Okay, however, the price is still one of the major barriers to achieve hepatitis C eradication, mainly in low and middle-income countries. Several studies summarized in Table 1 show the role of quercetin as an antiviral agent against hepatitis C. So this is Table 1. It demonstrates effectiveness against, so this person tested the flavonoid for its antiviral activity against hepatitis C virus. Cell culture system treating in 3 hours after infection. The study showed how quercetin markedly blocks viral translation, completely blocks NS5A augmented internal ribosome entry, mediated. Moreover, the inhibitory effect of quercetin was also obtained using a model system in which NS3 engineered substrates were introduced. Okay. Molecular docking increased. Okay. The herpes virus. Okay, so this is about the herpes virus. Okay, a large envelope family of double-stranded DNA viruses, herpes virus, are divided into three subfamilies: alpha, beta, and gamma. Herpes viridae, based on biological properties, the alpha herpes virus, herpes simplex virus types 1 and 2, and varicella zoster have a short replicative cycle, induced cytopathology in monolayer cell cultures, and have a broad host range. Okay, the herpeviruses that infect humans characteristically establish a latent infection that may be reactivated later. The consequences of reactivation range from asymptomatic shedding to severe disseminated infection. Therapies that can target the latent phase of these virus infections could potentially result in eradication. It has long been known that quercetin derivates show antiviral effect on herpes viridae, HSV1 and HSV2. Herpes viridae activities of quercetin and derivatives. In vitro studies showed the reduction of intracellular replication of HSV1 and 2, the human cytomegalovirus, when cell monolayers were infected and subsequently cultured in medium containing quercetin instead of pre-incubation of tissues. Culture cell monolayers with quercetin did not affect the ability of the viruses to infect or replicate the tissue. Quercetin showed antiviral activity towards HCMV1 or HCMV infected cells in a concentration of 4.8 micrograms or micromoles. That's micromoles. It was found that quercetin partially inhibited the production of immediate early protein and strongly inhibited early protein production, suggesting that the flavanol operates at a time point between immediate early and early protein expression. Okay. These findings suggest that anti-HSV1 effects of quercetin are related to the suppression of the quercetin, and isoquercetin displayed potent antiviral activities against both VZV and HCMV, both components strongly suppressed and expressed of lytic immediate early genes. Okay, nevertheless, have shown, assuming that the anti-herpes effects of the extract might target virus particles directly and inhibit further stages of herpes virus infection. Okay, in vitro studies, whatever. This is a different virus, is a family of viruses that possesses segmented, single-stranded, and negative sense RNA genome. It compromises the general, these are influenza viruses, thogovirus, blah, blah, blah. Okay, currently 2 classes of okay, so let's just get down. Several in vitro studies performed on cells showed anti-influenza A activity of quercetin derivatives. Particularly, they seem to have an effect on the initial stage of the infection. In a study, influenza virus was inoculated to the cells, and the virus-infected cells were incubated in the presence of quercetin and isoquercetin in different concentrations and different stage of infection. Isoquercetin showed the highest antiviral activity, and the incubation of the cells with isoquercetin prior to viral infection, followed by extensive washing, significantly inhibited viral replication with an effective dose for 50% reduction on viral replication. Anti-influenza activities of quercetin derivatives. A quercetin derivative of was able to significantly decrease copy numbers. Okay. In vivo study on mouse model of influenza virus showed how quercetin derivatives significantly decreased mortality, reduced the levels of IFN. Molecular docking studies. Let's get down here. Quercetin derivatives have shown the ability to block viral RNA polymerase, showed strong inhibition activity. A recent study was conducted to confirm this inhibition. 410 quercetin derivatives were screened using molecular docking. Okay, and already mentioned, quercetin seems to block virus entry, the initial step of viral replication cycle. Okay. So we're going to not talk about this one because I don't want to get myself into any trouble, but you can read this study on your own. Quercetin seems to protect against the unspeakable thing that shan't be spoken of. Okay, hepatitis viruses. Okay, so hepatitis B virus. Okay, several in vitro studies show how quercetin inhibits hepatitis B virus. Okay. Anti-hepatitis B virus activities of quercetin extracted. Okay, let's just get down here. Okay, these in vitro studies show how quercetin can block hepatitis B virus replication. Retroviridae. Retroviridae is a large family of RNA viruses that replicate through a DNA intermediate. It is divided into two subfamilies. Okay, highly active antiviral therapy, blah blah blah. In vitro enzyme inhibitory, blah blah blah. Quercetin. Okay. It seems that quercetin reactivated latent HIV-1 gene expression. In addition, there is evidence that quercetin may reactivate HIV-1 expression. Okay. In conclusion, as shown in Table 1, quercetin seems to inhibit in vitro HIV-1 replication acting on integrase. Okay. However, these results need to be confirmed. So, so anti-HIV activities of quercetin and derivatives. Okay. Dihydroquercetin showed antiviral properties against this virus here. Rhinovirus, it shows effects against virus. Okay, quercetin derivatives seem to inhibit Picroneviridae family by acting on early stage of the virus. Pneumonia. Okay, so let's see here. Several studies investigated the quercetin mechanism of action by molecular docking. Anti-pneumonial activities of quercetin. Other research suggests that quercetin and its derivatives exert their action by interacting. In conclusion, quercetin could experts in antiviral action interacting with structural and non-structural protein and reducing pro-inflammatory cytokines. Filoviridae. Filoviridae family comprise a large envelope negative sense RNA. Okay. So, anti-Ebola virus activities of quercetin. Recently in study hypothesis, the use of flavonoids against Ebola virus proteins that cause a protective immune response. Okay, the docking studies indicated that flavonoid compounds have strong hydrogen binding interactions and high docking score with Ebola proteins. Okay. So, treat it with quercetin. Quercetin inhibited viral replication. Yada, yada, yada. Conclusions. Quercetin and its derivatives are naturally occurring phytochemicals with promising bioactive effects, such as immune protection, anti-inflammatory, and antiviral effects. In this review, the antiviral activities of quercetin and its derivatives against potential human viruses was collected. Quercetin showed a potent antiviral activity in vitro, and the different mechanisms of action are reported in Figure 2. So this is the different highlight on different antiviral. Now let's see if I can open this image up. Okay. So yeah, this is the image here, and it's showing what it does. Okay, highlight on different antiviral mechanisms of action. Okay, so let's see if I can get out of here now. So treatment with direct-acting antiviral drugs dramatically changed outcomes of okay, anti-HCV. Oh, wait, put me back up here. Okay, antiviral activity of quercetin. Let's see. All these studies show how quercetin and its derivatives have a wide spectrum of antiviral activities, and a better understanding of quercetin's mechanistic properties could help in the rational design of more potent or bioavailable flavanol-type compounds. Quercetin's implication for autoimmune diseases. Autoimmune diseases are a worldwide health problem with growing rates of morbidity and are characterized by breakdown and dysregulation of the immune system. Although their etiology and pathogenesis remain unclear, the application of dietary supplements is gradually increasing in patients with autoimmune diseases. Introduction: autoimmune diseases are a heterogeneous cluster of disorders characterized by systemic syndromes in which reactive adaptation or adaptive immune responses contribute to immune-mediated damage to cells and to organs. The pathogenesis and etiology, blah, blah, blah. Okay, people know what autoimmune diseases are. Okay, biological activity and functions of quercetin in dietary supplements. Daily doses of quercetin are usually in the range of 1 to 250 milligrams. After ingestion, quercetin can combine with salivary proteins to form soluble protein quercetin binary aggregates. Upon arrival in the small intestine, quercetin is deglycosated by lactate, in the sebum and colon, quercetin glucosides can be directly taken in via sodium-dependent glucose transporter 1 or secreted into the lumen, blah, blah, blah. Quercetin exerts powerful anti-inflammatory effects, mainly via inhibition of cytokine production, reduction of cyclooxygenase and lipoxygenase expression, and maintaining the stability of mast cells. It can reportedly reduce streptococcus-induced inflammation by inhibiting the activation of P38, nitrogen-activated protein kinase. Okay, and one study, treatment with quercetin at a dose of 25 milligrams per kilogram in diabetic rats reduced the production of prostaglandin E2, IL-1 beta, and leukotriene B4, promoting wound healing in rats. Similarly, quercetin inhibited the production of TNF-A, IL-6, blah, blah, blah. Okay, okay. Let's see here. The excellent antioxidant activity of quercetin is mainly exerted via effects on the activity of glutathione enzymes and reactive oxygen species, and regulating signal transduction. Okay. Quercetin has undergone clinical trials, and to date, significant toxicity or side effects have been observed. Quercetin has undergone clinical trials, and to date, no significant toxicity or side effects have been observed in humans. Inhibitory effects of quercetin on inflammation have been observed in clinical studies, as it has the capacity to suppress multiple types of cancer. More clinical studies should be conducted to confirm the effect of quercetin on autoimmune diseases. Now, keep in mind, some people believe that cancer is an autoimmune disease, okay? So keep that in mind, but it does seem that quercetin is very effective against many forms of cancer. Quercetin in autoimmune diseases, rheumatoid arthritis. RA is a systemic chronic autoinflammatory disease. The main clinical symptoms of synovitis and progressive destruction of multiple joints, which can lead to joint deformity and dysfunction. It can also cause multi-system damage and, in severe cases, premature death. In a randomized, double-blind, placebo-controlled clinical study, quercetin significantly alleviated morning stiffness and pain in rheumatoid arthritis patients. Okay. The monocytes were cultured. People can read this on their own. Inflammatory bowel disease encompasses a group of complicated and multifactorial polygenic conditions, mainly comprising ulcerative colitis and Crohn's disease. It is characterized by chronic, progressive, and relapsing inflammation in the gastrointestinal tract, which increases the risk of colitis-associated cancer. Quercetin has been shown to be potent anti-inflammatory component in a variety of in vitro and in vivo bioassay models, but oral quercetin has not exhibited the desired effects in the colitis model. Unless the flavonoid is introduced in the glycosylated form, which means connected to sugar, the most common of which is the compound rutin. Only approximately 10% of orally ingested rutin is generally able to pass epithelial cells. The rest is converted into to sulfate and glucuronide derivatives by the gut microbiota. Okay. Some evidence suggests that glycosylation of quercetin, as demonstrated by rutin, is an important structural feature of flavonoids with respect to their efficacy against irritable bowel, inflammatory bowel disease. Pharmacological efficacy of quercetin. The oral administration of quercetin-loaded microcapsules generated with a pectin casein polymer attenuated macroscopic damage and edema reduced. So basically, nanoparticles of the stuff. Overall, available evidence suggests the efficacy of orally ingested glycosated forms of quercetin, such as rutin or quercetin, delivered via drug carriers for IBS. A common aminosalicylate drug also functions via interaction with colonic microbiota, resulting in the release of active moieties at the IBD site. Multiple sclerosis. Multiple sclerosis is an autoimmune inflammatory disease of the central nervous system characterized by extensive demyelination and neurodegeneration. Okay, in an in vitro study conducted using peripheral blood mononuclear cells for MS patients, treatment with quercetin reduced their proliferation and modulated levels of IL-1 beta matrix, blah, 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 chronic, okay, other immune disease, other autoimmune diseases. Systemic lupus is a disorder characterized by immune-mediated inflammation and overproduction of autoantibodies. Quercetin attenuated the symptoms of lupus nephritis. So it attenuated the symptoms of lupus-induced inflammation of the kidneys. Quercetin can reportedly inhibit DNA damage by modulating oxidative stress in lymphocytes from Graves' disease. Atopic dermatitis is an autoimmune and inflammatory disease, a skin disease characterized by skin lesions exhibiting infiltration by mast cells, eosinophils, and macrophages in a mouse. Okay, conclusion. Autoimmune diseases are systemic conditions, blah, blah, blah. Quercetin possesses anti-inflammatory, antioxidant, neuroprotective, and anti-allergic activities, as well as the capacity to interact with multiple molecules and targets. Moreover, treatments involving appreciable doses of quercetin have evidently been low toxic or non-toxic. Quercetin will be expected to become a potential opportunity and supplement for the treatment and prevention of autoimmune diseases. However, it is particularly important since there is no evidence so far that quercetin could reduce the morbidity and mortality of autoimmune diseases. The direct effects of quercetin on immune imbalance in patients are still unconfirmed. Further clinical studies are still lacking. Now, people remember I bring up the 90 essential nutrients a lot, the 90 essential nutrients by Dr. Joel Wallach, and I also bring up a lot the concept of the triage theory of aging and disease by Dr. Bruce Ames. Now, what's interesting is people with multiple sclerosis have lower levels of important antioxidant and anti-inflammatory nutrients like vitamin E, okay? Now, what's interesting, one of these nutrients is actually quercetin. One of the nutrients that they're low in is actually quercetin. And you can feel free to read this on your own when you get a chance. It's linked in the description, of course. Now, people may remember that I said what made me come across quercetin was a friend of my karate instructor had 2 children with cystic fibrosis, and I myself, my family doctor thought I might have pulmonary fibrosis, which led me to look up anti-fibrotic things that were anti-fibrotic. One of those things is quercetin, which led me to take lots of quercetin. So Results showed that quercetin dramatically ameliorated liver inflammation, fibrosis, and now this is in the liver, but it helps to reverse liver fibrosis also. So quercetin, this is about quercetin. Is quercetin safe? People might want to know. Now remember, I'm not a doctor, I'm not a nutritionist, I'm not a dietitian, I'm nothing like that. So this is not medical advice, but people might ask, is quercetin safe? Quercetin is a flavonoid found in many foods and herbs and is a regular component of the normal diet. Extracts of quercetin have been used to treat or prevent diverse conditions, including cardiovascular disease, hypercholesterolemia, rheumatic diseases, infections, and cancer, but have not been shown to be effective in clinical trials for any medical condition, yada yada. Quercetin as a nutritional supplement is well tolerated and has been linked to serum enzyme elevations, blah, 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 clinically, da, da. So ask yourself, is it safe? Quercetin is well tolerated and generally reported as having no discernible adverse effects. Abdominal discomfort, nausea, headache have been reported in some studies, but generally at low rates that are similar to those with the placebo therapy. Liver toxicity. Quercetin supplements have not been linked to serum autoaminotransferase elevations during therapy, although there have been a few focused studies of its hepatic safety. Furthermore, there have been no published reports of clinically apparent liver injury attributed to quercetin. Indeed, many in vitro and in vivo studies have shown that quercetin protects against hepatic injury caused by drugs and toxins, including acetaminophen and cancer chemotherapeutic agents. These hepatic protective effects have not been demonstrated in prospective clinical trials, but they have shown. Okay. And that's going to be all for this video. I hope that covers some of the rejuvenatory property or rejuvenation properties of quercetin, and I hope you watch the video. I hope you enjoy it, and that's all for this video.